Keep your pearly whites pearly white and clean. Mine might not be pearly white, but they damn clean, my fine feather friends. And that's not just for aesthetic purposes. That is for your health, not just your oral health, the health of your heart, the health of your brain. And we've spoken here at When Wellness about how poor oral hygiene can increase your risk for heart disease, right? And if that in itself won't get you to, go to the dentist or clean up your mouth and brush twice a day and floss, know that it could poor oral hygiene increase your risk for developing dementia. That's right, dementia. And we'll talk about this recent meta-analysis on a lot of people that showed a positive association with poor oral hygiene and increased risk for dementia here in a second. But what is going on with periodontal disease, right? Well, periodontal disease consists of gingivitis, right? Which can progress to periodontitis. So, gingivitis, that you get those red swollen gums, you get some tooth pain, you get bad breath. And it's reversible though, it's reversible. You clean up your mouth, you start to have better oral hygiene, you can reverse it. When it progresses to periodontitis, it's no longer reversible, and now your teeth can start to fall out. You're spitting out blood when you're flossing or when you're brushing your teeth. And again, it's irreversible. And if you get to that stage, right, where now your teeth are rotting, there are bacteria all over the place, all over our skin, in our gut. Some of them are good, some of them are bad, right? There's bacteria in our mouth, and they eat sugar, right? The bad ones eat sugar. And we talked about this, and we talked about how poor oral health can cause heart disease, at least increase your risk for heart disease. They eat that sugar, and then they produce acids as a byproduct. And these acids break down your enamel, the hardest substance in the human body, and degrade your teeth. And then that's how you get cavities, right? And you lose your teeth. And aside from cavities, just poor oral hygiene means, okay, there's more bacteria in the mouth. They're flourishing in there, these bad bacteria. And what happens is now they can get through your gums and they can reach systemic circulation. So if they reach your circulation, they can go, like we said, to your heart. They can go really anywhere in your body, but that also includes your brain, right? And so periodontitis can cause chronic inflammation in the central nervous system. The central nervous system consists of the brain and spinal cord, right? And it controls everything in your body. These nerves branch out off the spinal cord and they control all sorts of things, right? So that's why in chiropractic we adjust the spine to reduce pressure on the nerves, at least for one, and many other things, loosen muscles that attach to the spine, reduce inflammation in the spine, all this good stuff, right? But if they get into the central nervous system, these bacteria, and they cause chronic inflammation, they can damage your neurons, your brain cells. They can destroy your nerves and just destroy nerve function, right? And that includes things that control memory. So what do we have in terms of the research? Well, a recent meta-analysis on over 3 million people, so a massive sample size, albeit, it was on 46 observational studies, and observational studies don't necessarily show that, correlation means causation, but they show significant associations with things, and this one showed a significant association with periodontal disease and cognitive decline, cognitive impairment, and dementia. In fact, those with periodontal disease, on average, were 200% more likely to develop cognitive decline. They were 25% more likely to develop cognitive impairment, and they were 22% more likely to develop dementia. So next time you think about not brushing your teeth for a day, or not using some good toothpaste, or not going to the dentist, realize that it can increase your risk for cognitive decline and dementia, things like Alzheimer's disease and Parkinson's, all these terrible things, right? So that's what we got for you guys today. Go brush your teeth, my fine feathered friends. Who do we got out here? Ash, what's up, baby? The real Brento James. Meg, I see you in a bit. Bull City King Davies. Sabine, what's up? And Kazu. Thanks for coming on. As for now, that's all we got for you, folks. We'll see you tomorrow, baby. Not sure where, not sure when, but we'll see you then. Have an amazing day today. Thank you so much, and happy When Wellness. See you later.